Hello, my name is Kirsten, and this is my psych and film project. In the movie A Beautiful Mind, John Nash is a genius diagnosed with schizophrenia. Most of his time throughout the movie is spent at Princeton University, whether he be searching for his truly original idea, hanging out with Charles and Marcy, cracking codes for Wheeler under Parcher's command, working by the window in the library, having a psychotic break from reality in the courtyard, or teaching a class. Charles and his niece Marcy are Nash's biggest fans, while Parcher assigns John with various top secret missions to keep the U.S. from getting bombed by Russia. All are made up characters from John Nash's mind. Thanks to the absolute love and unwavering support of his wife, Nash is able to deal with the circumstances of his psychological disease, going on to win a Nobel Prize in December of 1994. John Nash has schizophrenia, which is located under the category called schizophrenia spectrum and other psychotic disorders in the DSM-5. When one thinks of this disorder, they can think of a break, a schism from reality and fantasy. These patients experience extremely disturbed thinking, emotion, perception, and behavior, and are unable to distinguish what is real from what is not. John Nash shows positive symptoms of schizophrenia. He experiences hallucinations as his best friend and roommate Charles is actually proven to be a character in his mind. The hallucinations are extremely vivid, as Charles is the person John asks for advice on whether or not to marry Alicia, for example, which Charles fully supports. On the other hand, Parcher, another hallucination, tells John attachments are dangerous for his job. Marcy, Charles's niece, is the reason Nash was able to figure out who was real and who was not because she never aged over the years. In addition, John also experiences delusions through reference, grandeur, and persecution. Nash has full conversations with Parcher, who works for a top secret part of the government. Parcher tells him that he is the best human codecracker he's ever seen, and he is meant to do great things with that, i.e., save the U.S. from getting bombed by Russia. While working for Parcher, John is convinced that the Soviets are trying to kill him due to his genius ability to crack codes for the bomb placement. These disordered ways of thought all coincide and lead John to be paranoid, constantly afraid for his life and fearing for his safety. Positive symptoms of schizophrenia include disorganized thoughts, hallucinations, delusions, disorganized speech, and excessive emotions. Of these symptoms, John Nash does not ever really exhibit disorganized speech. He doesn't have a problem with neologisms, loose associations, clang, or word salad as mentioned to describe this symptom in class. As a genius and a professor at Princeton, I do not believe he had trouble with disorganized speech, or he wouldn't have been able to teach very well because the display of this symptom would have made him very hard to follow and understand. The only reason he ever appeared to be hard to follow for his students was due to his most genius level of thought. The treatment plan for John Nash consisted of his psychiatrist doing some sort of insulin shot followed by what appeared to be seizures 5 times a week for 2 weeks in the hospital. His psychiatrist also gave him drugs to minimize the hallucinations. The projected long-term outcome of this treatment was basically that John would exist as less of a person, dependent and unreliable. John said the medication kept him from being able to do his work, help with the baby, and respond to his wife, so he stopped taking it. He learned to differentiate between reality and fantasy on his own terms and was successful. Not taking his medicine led the therapist to believe that since schizophrenia was a neurodegenerative disease, his breaks would only get worse and never better. John learned to cope well with his breaks, even at the end of the movie when he was older. Around 40% of patients can be treated with medication to alleviate the symptoms of schizophrenia. While John's symptoms were mitigated, he felt he was less of a person and the drugs weren't worth it. It is typically appropriate for people with this disorder to have some sort of treatment due to their tendency to have these breaks from reality, whether it be via medications, psychosocial therapy, or hospitalization depends on the severity of the case. These breaks leave patients socially disconnected and hard to understand from the outside world. People with schizophrenia do not usually fit in, and it can be hard for them to get jobs and live normal lives when they are constantly experiencing schisms. Sometimes they don't even know anything is wrong with them because they can be so fixated on the fantasies. The ethical concern for drug therapy would be that depending on the drug, the person can just become a zombie, leaving them still unable to lead a normal life. Medication, however, is only one component of schizophrenia treatment and is not helpful in all cases. A separate ethical issue could be with hospitalization, depending on the facility elected and severity of the patient. A Beautiful Mind provided a vivid, accurate portrayal of schizophrenia through the character of John Nash. It allowed viewers to simultaneously believe in John's hallucinations with him so that they too could experience the realness that he was. The movie did not shy away from how he is publicly treated among peers as well, with his friends in the beginning constantly making fun of him and students after he starts attending class following him in a mocking manner, all the while Nash being completely unfazed by it all. The portrayal of psychological disorders in film influences how we think about psychological disorders in real life in a substantial and undeniable way. In a lot of cases, this may be our only exposure to such disorders if they are less common. Even so, it can give us a false sense of expertise that desensitizes us to the realities of these disorders. The ability to sympathize and empathize with these ailments, with the knowledge that every single case is different and unique to an individual, cannot be learned through a film, but must be cultivated by experience. Nevertheless, the film industry has the power to shine light on mental and psychological disorders like no other. We can only hope they do it justice. Thanks for your time.